Hello and welcome to the weekend edition of National Focus. I am Mervin Matthew. Coming up, Dominica has been declared a leader in IHR implementation. Acting Chief Medical Officer confirms a decline in the number of cases of Chikungunya, and developments in the Mahaut Constituency gains momentum. Stay tuned for details of these and other stories right after the break.
A lot of bathtubs are blamed for bruises. Some staircases are accused of being responsible for broken bones. Doors are occasionally viewed suspiciously as causing lesions. A high percentage of tables are accused of producing bleeding or trauma. Violence against women is a crime, and it's everyone's responsibility. It's inexcusable. If you're a victim or witness of physical or psychological violence or abuse, seek help and denounce the perpetrator.
Welcome back. Time now for the details of the news. Dominica's national epidemiologist Dr. Paul Ricketts is reporting that Dominica is way ahead in moves to implement the World Health Organization's International Health Regulations of 2005. Dr. Ricketts is also chairman of Dominica's Committee for International Health Regulations, or IHR.
The national legal framework to protect the spread of health threats in the world. It promotes health security throughout the world, and to minimize the impact of health threats and outbreaks on trade and travel in the world.
Dr. Ricketts referenced the SARS epidemic, which spread from Asia to Western countries and caused economic losses for several countries without SARS cases. He explained that a system of sharing would have mitigated the impact of SARS. Cases like SARS are reasons for the implementation of international health regulations. The 196 countries across the world who have agreed to its implementation also agree to the core competencies which have made IHR effective. Dr. Ricketts listed legal framework and the coordination and communication mechanism. Surveillance is another.
We need to have systems in place that are able to detect a health threat when it occurs. And when I talk about a health threat, it's not just infections. So now the scope of the IHR has broadened to include things such as radiation emergencies, chemical emergencies, and anything really that has a potential impact on human health.
Surveillance of both humans and animals is specified. Training and development of human resources for the sustainability of the regulations, lab support, and the mechanism for the assessment of hazards are also core competencies. Entry points also form part of the list.
We need to have strong mechanisms at the points of entry to monitor potential health threats going in and out of the country. For example, at each port, when a vessel is coming into the country, there's a requirement that those vessels must be interrogated to ensure that there's no unusual activity on board the vessel, whether in the case of the humans on board or within the nature of the cargo.
The hazard referred to in the IHR are radiation, food safety, and chemicals. A technical mission to assist Dominica in setting up a national focal point for the implementation of IHR has just ended, and Dr. Ricketts says the findings are that Dominica is way ahead.
Fortunate for us in Dominica, many of the requirements that we have on obligations we have on the IHR were already in place or very close to being in place. So we just need to tweak and to build on some of those things to ensure that we meet the obligations.
Consequently, the island will act as a model for other countries in the process of implementing international health regulations.
One of the outcomes, revelations from the mission is that Dominica is actually one of the countries best positioned to meet these obligations by 2016. In fact, they, they are requesting Dominica to be available to assist other countries in the region, not just in the Caribbean, but across the Americas internationally. Because one of the strengths that we have, and we've reiterated during this week, is a strong intersectoral collaboration in Dominica, so that we, on a regular basis, on a weekly basis, have communication not just within the Ministry of Health, but between the Ministry of Health and other key ministries and agencies such as the Ministry of Agriculture, the Office of Disaster Management. These are very key agencies, and this is now being seen as a model that other countries could follow.
A permanent secretary in the Ministry of Health, Helen Roy, says at the end of the mission that Dominica takes IHR very seriously. In more news, the Adult Education Division of the Ministry of Social Services is doing its part to contribute to nation building. The Honorable Minister for Social Services, Gloria Shillingford, was reporting to the House of Parliament when she stated that the Caribbean Secondary Education Certificate classes have been made available to adults across the country. For 2013-2014, more than 200 adults took the exams.
We have also this summer a program going on, and we also have the CSEC program. We have it in many of our communities, and my colleagues, I'm sure, might have looked out or hear some of those programs going on. We have in Marigot, we have in Westsea, we have in Woodford Hill, Benz, the Carib Territory, Grand Bay, we have in La Plaine, Layu, and as a matter of fact, 177 females and 43 males are presently enrolled in the program, a total of 220 persons.
The Honorable Minister also revealed the results.
In English, we received under the adult education 68% pass, in maths 65% passes, accounts 81.8%, in principles of business 63%, in social studies 72.2%, office administration 60%, human and social biology 100%, French 100%, and Spanish 100%. So very impressive passes with the adult education classes.
In addition to CSEC classes, a capacity enhancement and empowerment program has also been taken to adults in every district. 183 participants have been recorded. With such accessible and affordable opportunities available to adults, Minister Shillingford appealed to adults to desire more for themselves.
I really beg of all persons, instead of sitting down and saying that I dropped out of school and I cannot go back, the government has made the effort to be able to have this going for the people of Dominica. Leaving school or dropping out of school doesn't entitle you to just sit on the road and just say that all is lost. All is not lost. Much is happening in our adult education program under my ministry, and much is happening through the Commonwealth, through the government of Dominica, and we should take advantage of those programs.
In more news, Adventist International Medical Missionaries, or AIM, a non-for-profit international humanitarian organization, is hosting a medical missionary trip to the island of Dominica. In an exclusive interview with GIS News, events coordinator Nurse Priscilla Prevost revealed the purpose of the health mission.
The whole idea what the Seventh-day Adventist Church is involved in is a lot of education, a lot of prevention, so that people can know exactly where they are, what their status is, and they can take the necessary steps to prevent condition from getting worse, or they can take steps to maintain good health. And this is what this is all about. It's not only a matter of treating people when they are already sick, but it is educating people how they can prevent themselves from getting sick, because we know the chronic non-communicable diseases, most of them are preventable, largely preventable. That has been verified by research, and we know the high blood pressure, diabetes, cancer, to a large extent, can be prevented by changing lifestyle, changing our diet, eating more fruits and vegetables, getting regular exercise, avoiding the use of alcohol and tobacco. And if we would just follow those principles, 4 major principles, we would reduce the incidence and the prevalence of many of the chronic diseases that we have now in Dominica. She provided details of the services which will be provided during this visit. Some of the services that they provide include health screening for diabetes and high blood pressure. They do medical examinations based on the specialists that they have available coming on the trip. And for this trip, they have an optometrist and a dentist, so they'll be doing dental screening, extractions, and filling. And they also do some other humanitarian things. They distribute items, food, clothing items to those in need. They also provide health education and pastoral care. Nurse Prevost revealed that the Ministry of Health as well as the All Saints University are partners with AIM in this venture. The Ministry of Health is encouraging working along with the district doctors to facilitate and to partner with the program. Also, I think All Saints will be assisting with the Health Expo, with the health fair in Dublin on Sunday. On Saturday, the visiting missionaries will be at the churches in the communities of Dublin and Vacans from 9:30 a.m. to 1 p.m. They will conclude that visit with a concert at the Portsmouth Seventh-day Adventist Church from 4 p.m. Development in the Mahaut constituency is gaining momentum. Addressing the House of Parliament last week, Honorable Parliamentary Representative for Mahaut Constituency Reuben Blackmore reported on his constituency's notable achievements. One of the highlights of these was the progress in building inter-community linkages.
We have seen improvement to a number of these community roads. As I speak with you, Mr. Speaker, and I want to commend, I trust my gratitude to the Minister for Lands. And you can recall in Mondrian that there was a wall being placed across the road, and as a result, vehicles could not traverse from Mondrian going back into Campbell Road. We were able to acquire the portion of land by way of private treaty, and we are doing the connection under a community-based initiative. And I want to say thank you very much to the Honourable Minister for Constituency Affairs, Honourable Ambrose George. And you know, we sometimes place emphasis on big things, but the little things are very important. And I can recall going to Mondrian once, and of course, when it rains because of the higher elevation, a lot of water is deposited lower down and flooding people's home, etc. We were able to construct just recently a nice step with storm drains and railings, etc. And I can give the people of Mondrian just now, you're going to get the street lights, and that's what we stand for.
The MP went on to list the launch of the NEP Community Development Program in the constituency, which will focus on transforming Rodney's Rock in Jimmet into a tourist attraction. In addition to this, the minister informed on the accomplishment of facilitating sports in the Mahaut and Kinfield areas, as well as his sporting vision for Massac.
But Massac has always had, Madam Speaker, the reputation for basketball. And as I speak with you, I know there's plan for a national covered arena, but we're looking at having some indoor sports on the current location. And I know, Madam Speaker, we have to talk about that, and to make Massac maybe the center for basketball in the country, Madam Speaker. As I speak with you, we're trying to do some work because we have no stable land for a playing field in Massac. What we have is just the area next to the sea, and we have to think as to how do we put a retaining wall to widen the area and to make it at least get it up to some standard so we can have a proper sporting facility.
Recalling the damage done to his constituency as a result of Tropical Storm Ophelia, Honorable Blackmore said another major development in this area is the work done to ensure safety.
Whenever it rains heavily, people's lives were always in jeopardy. Now we actually felt a more devastating effect when Ophelia struck. And then we gave the people of the commitment, because I can recall going to Campbell Road and the Prime Minister came with me, and we gave them the commitment that we're going to ensure that we build river walls. Some of them were skeptical. For matter of fact, some people who never support the government for whatever reasons, is a choice, they said that the walls will never, if they were built, they're going to be built by Chinese. We're able to create a sense of a local economy by engaging local contractors. And then, if you drive from our right now, Madam Speaker, Massac, into Canefield, into Campbell, you can see that we have been able to do exactly what we said to the people that we're going to do. And the people's life are no longer in jeopardy, Madam Speaker. In Livewell Ho, we have been able to transform Livewell Ho. And not only building a river wall, but to create access for them.
The Mahaut MP also announced that 12 houses will be constructed in Jimmet to accommodate some who experienced great loss as a result of the storm. Among other prospective projects for the Mahaut constituency is the development of a cruise village at the current Canefield Airport site. A senior health official here has confirmed that there is a decline in the number of cases of chikungunya in Dominica. Acting Chief Medical Officer Dr. Charlotte Jeremy Coffey confirmed to GIS News on Friday that last month's figures show that there were over 3,500 reported cases and 141 confirmed cases. She attributes the decline in numbers to an extensive public awareness campaign.
I believe it's because of public awareness, but also with the symptoms that patients might be having. They make their own, they self-diagnose, self-treat, and they don't report. But I also think with the increase in public awareness and the seriousness of the disease, the widespread that we had some weeks ago, persons have become a little more responsible and maybe getting rid of their mosquitoes.
The acting chief medical officer says despite the decline, health officials will continue to take action to further reduce the spread of the virus, which is transmitted by the Aedes aegypti mosquito.
We continue with our education because the symptoms for Ebola are similar to that of chikungunya and leptospirosis, typhoid fever, malaria, and other diseases. And so our education is going to continue. Yeah, the alert is going to be greater and more work on the ground. We cannot stop.
Dr. Jeremy Coffey has applauded health officials for their contribution to the declining numbers.
For Dominica, I am proud of the employees, the people from environmental health, the district workers, the health team. Everybody has worked so hard. Health promotion, getting the information out, assisting the doctors, the nurses, the health teams with the information to get out, going on the media, etc. Everybody has really, I won't say exhausted, themselves, but they have worked really, really hard. And here we are, we have not even rested from chikungunya, and we are now with a threat. So hats off to everybody, and we just continue to work feverishly.
And that's news. Colette Ambo is next with a recap of this week's headline stories.
Welcome to this week's edition of Flashback. In the headlines this week, Honorable Prime Minister Roosevelt Iscariot has urged all Dominicans to collectively ensure that all communities are in a state of readiness in the event of a disaster. Honorable Minister for Trade Dr. Colin McIntyre said government continues to take all necessary actions to minimize fuel costs to nationals. The minister compared local fuel costs to that of other countries in the region in his address to Parliament last week. Also this week, Permanent Secretary in the Ministry of Health, Helen Oye, expressed concern about adopting proper health practices, especially during times of disaster. The Yes We Care program is yielding significant results. Honorable Minister for Social Services, Gloria Shillingford, said the program is fast becoming a model social support program for the region. The DLP administration has made a grant of up to $2,500 available to preschools, in keeping with its No Child Gets Left Behind policy. Honorable Minister for Caribbean Affairs Ashton Grano reports that despite the global economic crisis, government has invested in the best interest of Dominica's indigenous people through the rehabilitation of roads. And Invest Dominica Authority spearheaded a two-day forum to expand on government's ongoing reform program, which encouraged Dominica to make good business sense of the opportunities to gain funding for developing and expanding its business. Those were the headline stories which made the news this week. Back to you, Mervin.
Thanks, Colette, and that's the English news. McPherson St. Luce is next with the Creole highlights.
Allô tout le monde, bienvenue à cette nouvelle en créole. Non, moi c'est McPherson St. Luce. Premièrement, agence shipping en Dominique Katapé AV, management solid waste Dominique, pour faire assurer que les gens qui ont exporté vie battu l'autre pays ni en licence. Parole c'est là qu'a sorti officier relations publiques opérationnelles Geno Jacob.
Nous avons dit que yo même ni pour créer solid waste et puis faire sentir que yo pas basé mon la permission et puis licence. Comprenez? Pour yo ça pour ces conteneurs ces piles là aller l'autre pays parce que yo même qui un breach en loi et puis yo même si yo même loi même ka fait et puis yo aussi ka gouverneur yo aussi et puis si yo basé mon ça licence et puis d'accord et puis c'est mon ça là pour voir ces conteneurs ça ces piles là c'est bitan qui illégal à l'autre pays nous sommes yo en loi pour ça et puis yo ça le gouvernement et puis aussi majestoire ça demande yo l'argent qui yo même pani et puis ça que pas bon publication pour yo publicité pour yo comprendre et puis nous a dit yo pour travailler ensemble et puis nous pour faire sentir que nous toutes un des faits Dominique on met pays.
Alors nous fait un policy qui a concerné le management de pays là, ça a créé National Land Use Policy, aller devant le cabinet pour y discuter. Parole celle-là sorti Chief Physical Planner Kelvin Roll. Si l'homme monsieur Roll, il y a un département là qui a gardé devant le cabinet approuvé document cela pour y ça aller en d'autres états et puis plan là. Policy là c'est un différents documents qui National Land Use Plan ou là il a dû se manière Dominique ça développer qu'a servi tes pays là. Monsieur Roll fait parole qui policy là qu'a prend considération bagaille de l'eau, management et puis protection forêt, protection agricole en parmi d'autres. Rôle aussi fait parole management pour moun kabati kai, pli kai pour développement et puis ça fait infrastructure, ça c'est ça fait pont et bagaille comme ça. Et aussi fait parole qui police là ni bagaille pour protection terre, pour développement, ça fait tourisme. Monsieur Rôle dit police là bien grand pour management terre en pays là. Finalement, Rôle dit que police là c'est le premier pour pays Dominique. En la nouvelle, ça fait qu'à concerner maladie CNCDs, ça c'est maladie comme pisado et maladie comme ça, qui affecte plusieurs monde. Sinon, ancien nos Priscilla Privo, manière moun ka manger et puis tient la vie à yo, quand la causionné ces mauvais maladies ça là.
CNCD c'est maladie comme diabetes, high blood pressure, cancer, maladie lung disease. Et puis, nous avons qui plus moun ka tapé ces maladies ça et puis plus moun, plus jeune moun aussi, pas nek vieux moun. Avant c'était que plus vieux moun, moun à l'âge, pas vieux mais moun à l'âge qui te ka tapé ces maladies ça. Mais nous avons à présent jeune moun prime, jeunesse yo ka tapé ces maladies ça aussi. Mais ça, research moutoué qui autant ces maladies ça c'est comment nous manger, ça nous manger, qui lait nous manger, comment nous exercice et puis alcool et puis tabac, et puis tabac. C'est condition ça car many pli maladie. Quand ça a vie moins sabay, c'est a vie moins jaba domnicien. Autant l'année qui est passée et puis moi continuer ba à vie ça c'est pour nous manger plus fruits, plus légumes, plus poids, moins graisse, moins viande, moins manger fruits, moins sucre et puis moins sel. C'est qualité manger ça nous ni pour manger et puis ça que ça empêcher autant ces maladies ça.
Et puis finalement, le département statistique qui a conduit au programme mettait tout data plusieurs aspects ensemble. Si le chef département là, Prima Cart, programme là qui assiste le public là connaître data record pays Dominique.
Nous avons toute data, information pays là, et nous avons mettre dans en place là. Tout le monde qui ça servi. Nous tape qui information pays à quelquefois tout partout quelquefois nous passe à taper mettre les mains nous à suivre. Mais sinon pour y avait mettre en seule place il qui fait travail nous plaisir.
Nous ci plus détail comment ça conduit ce programme ça.
Nous regardons tout report qui nous ni et nous mettre ensemble. Après nous mettre ensemble, nous break li down et nous passer en machine. Et machine nan ka li information là. Et là il li information là, machine nan ka vie mettre comme même livre là ou mettre ya. Avec nous capons livre ça là et nous mettre dans computer so tout le monde qui ça access.
Messieurs mesdames, ça c'est tout pour nouvelle en créole pour à présent. Non moins c'est McPherson Saint-Luce. Ni un bon week-end. Au revoir.
Coming up next, your tip of the day.
DOWASCO recognizes that clean water is vital to healthy living. Therefore, it spares no effort in providing a clean, safe, and reliable system. Help keep our rivers safe and clean. Do not cut trees along the river banks and do not pollute with garbage, human or animal feces, and chemicals. Think water, think life.
Is your energy lagging? Though it may be the last thing you feel like doing when you're tired, exercise. Even a brisk walk can be more effective than a nap or cup of coffee at fighting fatigue. And that's all for this edition of National Focus. We always welcome your suggestions and comments. Drop us an email at gis@dominica.gov.dm or visit our website at news.gov.dm. Like us on our Facebook page, facebook.com/GIS News Dominica. You can also catch up on past National Focus newscasts on our GIS Dominica YouTube channel. On behalf of the entire news production team, I'm Mervin. Thanks for watching and have a great weekend.